Hi all, how are you? Today our topic is neurological system condition, that is Bell's palsy or facial paralysis. I hope all of you heard regarding the Bell's palsy and some of you experienced the patients with Bell's palsy, especially those who are working in the emergency department. How the characteristics of this Bell's palsy patients will be? What is Bell's palsy, signs and symptoms, what is the diagnosis and the etiology, what is the nursing intervention we can provide to these patients. Today we will see all of these things. So what is Bell's palsy? If you didn't subscribe this channel, please subscribe this channel to get the updated videos. So now we will look out these points. What is Bell's palsy? So we know that we have the nervous system, central nervous system and peripheral nervous system. And central nervous system, it consists of brain, brainstem and spinal cord, and the peripheral nervous system especially consisting of so many nerves. In that especially we are saying cranial nerves. There are 12 pairs of cranial nerves are there. So this issue, Bell's palsy, it is related to some of the problems to one of this nerve. So which nerve it is? Any guess? It is the facial nerve, that is 7th cranial nerve. So we will move through this Bell's palsy. So Bell's palsy, facial paralysis, damage to the facial nerve. As I discussed, it is the 7th cranial nerve, that is facial nerve. When there is any damage to the facial nerve, that will be resulting from any trauma or any infection, meningitis or any hemorrhage or any tumor, it can cause damage to the facial nerve. And this result in the paralysis of the one side of the face. So recovery usually occurs in few weeks without any residual effects. So usually it is recovery will be taking within a few weeks, 2-3 weeks. Within that the patient will be in the normal stage. So there is one side facial paralysis we can see in facial palsy, that means the Bell's palsy. So here what are the clinical features? If it is affecting to the one part of the face, so what is the features we can see here? The forehead not wrinkled. So if the patient want to wrinkle the forehead, he cannot wrinkle it, the paralyzed side. And eyeball is rolled up. The eye will be open, wide open, and eyeball will be rolled up. Eyelid does not close. That is also a main problem. One of the affected area, eyes will be always open, and there is a chance for the dryness of the eye, and itching will be there in the eyes, and patient will complain eye pain also in this condition. And flat nasolabial fold will be flat, and paralysis of the lower face also paralysis we can see, and flaccid facial muscles and loss of taste. Even for the chewing also it will be affecting. So the patient cannot chew on that affected side. Sometimes we can see the drooling of the saliva also from the one side we can see. So whenever the patient, if you are getting a patient with the complaints of paralysis of the face, you can experiment as a nurse itself. You can ask the patient to drink some water. Give a glass of water and ask the patient to drink it. So you can see the water will be drooling from the affected side. The affected side, the lips, it will be little wide open, it will be. So there will be drooling, you can feel in that case. So like that. So here also in this picture you can see inability to burrow brow and drooping of eyelid, and the patient cannot close the eyes, and no muscle tone on the cheeks. In the cheeks also there will be no muscle tones. Even if we are touching on that patient's side, the patient cannot identify the touch. The pressure of the touch, the patient cannot able to tell. And drooping of the mouth, and cannot shine or pucker lips, all these symptoms, and while the patient is smiling, one side it will be deviated, okay, like this. If the patient is smiling, it will be like this. So with these symptoms you can identify the patient with the Bell's palsy. Initially you can identify these patients. So now we will go through the etiology of this Bell's palsy. What will be the etiology? We have seen that there are so many viral infections are there that can be a reason for this Bell's palsy. So here herpes simplex, herpes zoster, and Epstein-Barr virus, varicella zoster, and cytomegalovirus. Even sometimes influenza also, the study shows that influenza also will cause this Bell's palsy. And the bacterial, we can say Borrelia burgdorferi, that is the bacterial infection it will be causing. And sometimes for it is due to the instrumental delivery, okay, while using the forceps and all, there is a damage to the facial nerve. It can be, but after few weeks it maybe will be fine. So these are the etiology for this Bell's palsy. I hope you understood up to here. So now our main important point is the intervention. For us, we have the importance in the nursing intervention. So part of medical management, usually we are giving the corticosteroids, and corticosteroids, especially prednisone, that will help to reduce the swelling of the facial nerves. And anti-inflammatory action will be there. So that one will be continuing for this at least for 6 weeks, or based on the doctor or based on the Bell's palsy seriousness and severity, they will be prescribing this prednisone, and that is steroids. And if it is due to the any viral infection, we are providing the antiviral treatment to the patient. So other nursing intervention, we have to inform the patient regarding the facial exercise. We have to teach the patient the facial exercise, and like a facial sling or chewing gum. Ask the patient to use the chewing gum, so it will help for the muscles for the chewing. Okay, and as I discussed, it is steroids, antivirals, and protect the eye from dryness and prevent injury. That is more important. So I told that in this Bell's palsy, the patient's one eye, affected eye, will be always open. So we have to cover the eye, especially in the night time. We have to cover with the eye shield, and there will be some eye ointments will be there that can close the eyelids in the night time. Or if it is not closing or it is not sticking properly, ask the patient to do it manually. He can close the eyelids while he is sleeping, and cover and protect from the other infections, dust and all, and dryness. And promote frequent oral care because of continuous drooling and all, hand chewing also. Once some particles will be on the affected side, there will be chances for the mouth infections. So we have to provide the frequent oral care. Instruct the client to chew on the unaffected side. Always ask the patient to chew on the unaffected side. And increase the muscle tone by doing the muscle strengthening exercises. And physiotherapy, all these things we can provide for these patients. Okay, up to here, these are the nursing interventions. And for this nursing diagnosis, if you are saying there will be disturbed body image will be there, impaired sensory process will be there, impaired sensation, all these things it will come under the nursing diagnosis. I hope this you can write the nursing interventions for this nursing diagnosis. So our topic, I think that you all are clear regarding the Bell's palsy. It is a simple topic, easy to identify, easy to understand the topic also. So it is a paralysis of the facial nerve, that is 7th cranial nerve. It is not that much serious. If you are seeing a patient with one side paralysis, that means facial paralysis one side, don't get panic. Some nurses, they will misjudge it as a CVA, like a stroke sign. So always you have to identify whether it is a stroke or it is a Bell's palsy. So there will be stroke scale will be there, and for the Bell's palsy also, so diagnostic features will be there. With that you can identify whether it is a stroke or Bell's palsy. I hope all you understood today's class. Thank you.